Hi, I'm Dr. Stephen from the Oxford Veterinary Hospital. Welcome to our program, All About Animals. We got an exciting 30 minutes for you today. We're going on the road. We're going to go to an emergency clinic. Most of us have been to an emergency clinic one time or another. If not for our pets, certainly for ourselves. But it wasn't that long ago that we didn't have emergency clinics. We had hospitals, but we didn't really have an ER, and we sure didn't have them for our pets. Back in the olden days, when I was a little kid, veterinarians would have a bag like this. In fact, this was my father's bag. He was a veterinarian, and back in the 50s, I remember this bag being brought home every evening, and it had a very distinct smell. You can smell the leather, but on the inside, it was magical. All of this equipment. This was a hospital in a bag. He had his medications, and the pharmacy was something that he would have to mix up and administer. Who remembers these syringes, these old glass syringes? The only time you see these anymore is in a horror movie, but they actually worked and were very efficient with reusable needles. Our suture material came in little packets, glass packets that we had to break open, and electricity, well, it wasn't always available, so we had little hand clippers. It worked. We did a good job. We did as good as we could do. Anesthesia, that was another matter. We'd use something like this. This is an old ether mask. The nose would go in here, cotton would go here, and you'd literally pour the ether on and breathe it in until you fell asleep. Well, we've come miles since then. We evolved from this to established clinics with full service, and in the 60s and 70s, you wouldn't have expected the veterinarian to go to your home, but you would expect the veterinarian to meet you at the clinic. And it would be late at night, I'd go in with my dad, and I'd serve as his second helper because his staff needed to sleep. It was okay for him to get up in the middle of the night, but not for them. But sometime in the 70s, we took a turn. In the Detroit area, there was an emergency clinic established that was manned with full staff, licensed veterinary technicians, and they were there all night long. So it wasn't a matter of patching things up until the morning. It was a matter of tackling that problem and getting right onto it until you got it taken care of. And if you needed emergency surgery, it was done then and there, and our pets were so much the better for it. Well, we've taken a greater leap. Now we have emergency clinics that combine with critical care facilities, and they are on a par with the finest human facilities in this area. We really set the bar high in Southeast Michigan. So today, we're going on the road. We're going over to the Michigan Veterinary Specialist Critical Care and Referral Center, right over there on Walton Boulevard. And we've got some friends that are going to meet us there, so let me pack up this bag, let's get going, and we'll see you over at MVS. So as promised, we've taken a road trip, and we're here at the corner of Squirrel and Walton Boulevards at the Michigan Veterinary Specialists. And I want to introduce you to a very good friend of mine, Dr. Loretta Lee. Hi, Dr. Lee.
Hi, Dr. Steve. How are you today?
Very good. So nice of you to have us here today. Thank you.
Thank you for coming.
You know, we're here because our clients are faced with emergency situations, and our pets are a lot like our children, and when something happens, to take your pet somewhere that you're not familiar is a scary, scary event. And this is such a beautiful facility, and I know a lot about it, but our viewers and our clients and friends don't. So can you tell us, what's the official title of this facility?
The official title is Michigan Veterinary Specialist, Auburn Hills Facility of Blue Pearl Veterinary Partners.
And what is your role here?
I'm the Emergency Services Manager, and I'm also the Internship Director.
You know, we are anxious to get a behind-the-scenes view of what goes on when our pets come in for an emergency. Are you able to help us with that today?
Yes, so today we're going to see a patient come in, and we're going to go step by step from when they first come in to when the patient leaves the hospital. So
we'll follow a patient all the way through whatever the problem is and get to see everything in the back and all that's done?
Yes, so everything in the back, all the testing that's done, you'll be able to see that today.
That'll take a lot of the mystery out of this and help us with when it's a difficult time with emergencies. So let's get going.
All right, let's go.
So here we are at the inner sanctum of this wonderful facility, and nobody ever gets back here unless you're dressed like this. And Loretta, Dr. Lee, who is this masked man?
This is Dr. McAbee. He's our new surgeon here. He's board certified, and he's from Denver, Colorado.
Tell us a little bit about yourself. Where are you from?
I am from Denver, Colorado, originally from California, and I'm happy to be here in Michigan now, head surgeon here at Auburn Hills facility. Yes, I am board certified, which means I was trained after vet school to do just surgery on small animals, dogs and cats. And I do some very interesting things in the middle of the night here, and most often I'm doing either some kind of abdominal surgery on dogs or cats that ate something they're not supposed to, or unfortunately if their stomach twists on itself, sometimes I get called in for that, or sometimes neurologic surgery when the dogs can't use their hind legs.
Well, and you bring up an important point, middle of the night, because,
Yes.
I do a lot of surgery. I've been a veterinarian all these years, and those surgeries, most of those surgeries are not foreign to me, but sometimes you just can't wait till the next day, can you?
No, you can't. Absolutely not. Time is of the essence when a dog has eaten something they're not supposed to, if their stomach is twisted or if they can't walk. The longer they are that way, the shorter, the less amount of time we have, or the less ability we have to turn that situation around.
Absolutely, and for me to come into my office by myself with a client, maybe one other staff member, just doesn't compare to what you can offer our clients here.
There's no question, and I cannot do this by myself. There's so many people around me that will come in with me in the middle of the night that will help me, trained technicians, other doctors. We all are a team taking care of these animals in the middle of the night.
Well, we're so glad you're here, and we want to welcome you and hope that you have many years of successful practice here.
Thank you very much. It's good to be here.
So Dr. Lee, this is a great opportunity for our viewers to see what goes on in the OR. Can you tell us a little bit about what's going on here with Dr. McAbee and his patient?
So Dr. McAbee is doing a surgery, a foreign body surgery right now. He has everything set up where he's sterile, the patient's under a sterile sheet too as well, and then we have a technician that's monitoring the anesthesia at all times.
Well, this is a fascinating view. I think, though, we better leave here and let Dr. McAbee focus on what he's doing. Dr. Lee, there's a whole lot of little rooms here, and here we are in this room. Can you tell us something about where we're at and what goes on in here?
So this is the radiology room. This is where we take our x-rays. We have digital x-rays so that the x-rays can be sent to our radiologist for viewing. And this is a leaded room so that it's protected the other employees when we're taking x-rays.
Wonderful. Lots of pill vials I see and all sorts of machines. What's going on in here?
So this is our pharmacy and also our laboratory, in-house laboratory, so we can have lab results very quickly, especially in the evening when major labs are closed. So this is a client of ours that it's coming in for an emergency today. And then she is speaking to the receptionist, and the receptionist will call the triage technician to come in.
You know, Dr. Lee, one of my questions is, how the devil do you know clients, emergencies start on the phone many times. Is your staff able to sort that out?
Yes, so when a client calls and they're not sure if they're supposed to come in, we have our technicians speak with the client, and if they're not sure, then they'll ask the doctor too as well. So we can help direct them if they need to come in.
Triage to the lobby, please. Triage to the lobby.
So our triage technician comes up even before the doctor, greets the client and the patient, and what's her role? What's a triage technician do here?
So the role of the triage technician is to make sure that this is Mulligan and Mulligan is stable. So she'll check the heart rate, listen to the lungs. So the technician and the client will go into the room, and that's where the history is being taken.
History is such an integral part of this entire experience.
Yes, and so it's very important to have a very accurate history. It just really helps us determine what is happening and what tests that we need to run. There's so many possibilities of what's happening, and so the history is very important for us.
It's a skilled technician and a skilled veterinarian that can extract the history from an upset client. The animal's been sick, things are running through their head. Most people come in with a diagnosis. They've already figured it out or think they figured it out, and they're looking for answers. And what your job and the technician's job is to reestablish a timeline so you can determine what happened when, so that you can apply your knowledge to this patient to determine what needs to be done next.
Correct, yeah.
Wonderful.
So now that we're in the exam room, Heather is finishing up the triage and then also going to ask Kathy the history questions.
Okay, so how long has Mulligan been vomiting?
Probably for about 6 hours.
And you say he's being quieter at home than he is?
Yes.
So Dr. Steve, we're going to follow Heather back, and she is going to speak to the doctor, the emergency doctor that's on, and we're going to find out what their plan is, and then the emergency doctor will come back in and do an examination on
Very good.
Mulligan.
Very good. So Dr. Lee, we went past the locked doors. We're back here in the back portion of this facility. Tell us a little bit about where we're at and what goes on back here.
So this is our ICU station, and this is the main hub where we have our hospitalized patients over here. We also can view x-rays, we have a workstation, and we also have a laboratory too as well. This is also where Heather and Dr. Camaro are speaking about Mulligan's care.
So Heather's triaged Mulligan. She's got some appreciation for what's going on, and she's sharing that with the doctor.
Yes.
What's the next step after this?
So the next step is Dr. Camaro will go back into the exam room and speak with the client, and then also do an examination on Mulligan to find out what's going on.
Great.
Hi, my name's Dr. Corrine Camaro. How are you today?
Hi, Dr. Camaro. Good.
All right, this must be Mulligan.
Yeah.
I understand we've been vomiting and lethargic today.
Yes.
All right, hey Mulligan, can I take a look at you, buddy? Hi. Okay, so I have some concerns about Mulligan, obviously with the vomiting, and I hear that he gets into things pretty regularly. Yes. Eat everything kind of dog. So I do worry that he could have something obstructing his gastrointestinal tract.
Okay.
Abdominal x-rays are a good way to rule that in or out as a suspicion for that problem. My other concern with him, though, his mucous membranes, his gums, are a little pale and yellow. Also, he has a heart murmur on my examination today. Both of those things can lead to a diagnosis of anemia or low red blood cells. My concern is that he might be having his red blood cells broken down, causing that anemia and then that heart murmur as well. So in order to get a good picture of what we're dealing with Mulligan would be to start with the abdominal x-rays as well as some preliminary in-house blood work to kind of verify whether or not we have that anemia present. Right now, the next step is for Heather to come in and go over an estimate of cost for those preliminary diagnostics. After those have been performed and we have a better idea of what we're dealing with, then we'll come up with a full treatment plan based on what Mulligan will ultimately need, okay?
Okay, great.
Do you have any questions for me right now?
No, that sounds great.
Okay, thank you.
Thanks.
Hi, Mulligan. So you met with Dr. Camaro,
Yes.
and she talked to you about doing some x-rays and some blood work,
Yes.
correct? Okay. So what I have here is that treatment plan. This does include Dr. Camaro's exam, the x-rays, and then the in-house blood work.
Okay.
Okay, so that would be the total to get these diagnostics started.
That's a little more than what I'm used to seeing when I go to the referring veterinarian. Why is it different? Why is it a little higher?
Well, we are a 24/7 clinic, so we do have doctors and technicians here 24 hours a day, 7 days a week, so that's part of it. We also have a board-certified radiologist who reviews all radiographs that are taken, just like at a human hospital, so we do need to cover that expense as well. And we do have specialists that we can also call in for consultations as well, so kind of all of that encompasses the cost.
Okay. And about how long will this take?
About 15-20 minutes is all it should take me, and then we'll have some
Okay.
answers for you. So
Okay.
if that's okay, I just need you to sign there.
Very good.
All right, Mulligan, that means you're going to come back with me, big guy.
Okay, so we're going to follow Heather back into the ICU, and that's where they're going to start running the x-rays and then also taking some blood work.
Let's go back.
Okay?
All right.
So Dr. Camaro is drawing blood. The x-rays have already been taken.
Now that's interesting. She went right up to below his jawline along his neck to draw a blood sample. Is that typical?
That's typical, especially on an emergency basis. The reason for that is because the veins that are on the legs, we use those for catheters, and especially in an emergency situation, they may be very difficult to get. Also, we get the largest amount of blood from the neck area too as well.
I noticed it was very quick and it didn't seem to bother him at all.
Right, that's correct. Dogs and cats tolerate getting blood from that area very well, and so that's a common area that we'll draw from.
He seems very relaxed without his owner here. I think that's a tribute to your staff and the way that they handle the pets.
Yeah. Here we like to use a minimal restraint sort of attitude, and so we want to make it very calm and inviting in this area so that the animals are not stressed and it's easier to work on them.
And Mulligan's owner is waiting out in the reception area.
Yes.
And then we're going to go back out and talk to her and let her know what's going on.
Very shortly. So Dr. Camaro, these are the x-rays taken on Mulligan. What is going on in these pictures?
Well, here we have a picture of him laying on his back. We have these metallic objects here look to be within his stomach. Here again is another view with him on his side. His head is sort of facing this way and tail this way. And we again see these same number of metallic objects present within his stomach here. My thought is that we may have some pennies within there as well as some other coins. Pennies can contain zinc and cause hemolytic anemia, so this may explain everything that we're seeing in Mulligan. I think at this point it's warranted to call in our on-call specialist, speak with her about the case and see if she would be willing to come in and do an emergency endoscopy to remove all of those coins from the stomach.
And what's going on with the blood work?
Right now, the blood work is showing that we have an anemia, which is what we suspected, so a low red blood cell count. We're concerned that Mulligan may also need a blood transfusion, which is not uncommon with these types of situations.
Dr. Camaro, is this something that could wait till tomorrow until Mulligan gets back to his regular veterinarian?
Unfortunately, it's not. We can see continued breakdown of the red blood cells, and we may be in a pretty dire situation by that point. So a blood transfusion as soon as possible is recommended. And also, not all regular veterinarians have the capability for doing endoscopy. It is a non-invasive way to go through the esophagus into the stomach and remove those coins without actually having to do surgery. So the sooner we get them out, the better, because that's the real thing that's going to stop the breakdown of the red blood cells here.
Sounds like a very good plan for Mulligan.
Thank you.
So the next step, Dr. Camaro will speak with the client about what she found, and then we can start treatment very shortly.
We're worried about the fact that there could be pennies present in the stomach, causing hemolytic anemia, so breakdown of the red blood cells because of the zinc present within the pennies.
Okay.
So between that and the low red blood cell count, it's very important that we have Mulligan stay here in hospital with us so that we can address these matters. First, we will have a blood transfusion started so that we get his red blood cell count back up to normal. And then soon thereafter, our internal medicine specialists will come in and do an endoscopic procedure where they actually take a little camera and go down the esophagus, and associated with that are little hemostat type grabby objects that can pull those pennies out one by one, and our hope is that we can get all of those out in one go with the endoscopy, not having to go to surgery. However, if we find that the pennies have passed into the intestinal tract, are no longer within the stomach, then we may have to go to emergency surgery. We do have our board-certified surgeons available 24 hours a day, should that be the case. Based on these x-rays, I'm hopeful that we can get all these pennies out just with endoscopy alone.
Okay, I hope so too.
I know. All right.
All right. Okay, let's go for it. Oh, here. Good boy. Nice job. Oh, cold, wet, white.
Good man.
That's my handsome boy. Nice job.
Good, that being behaved. Or it's better technician.
He says it's not my mom.
I've got a T-port there, but I wasn't going to make it all. I mean, it is just him. I figured better up to make it look nice, but.
Nice job, Mulligan. Very good boy.
I wasn't planning on videotaping the character replacement.
That's all right.
So here we are in a specialty treatment room with Dr. Boyd and her veterinary technicians. Tell us what's happening here.
So the endoscopy procedure has already been done. Dr. Boyd is successfully taking out the coins, and there's a penny right now that she's just picked up. And then right after, Mulligan is going to receive the blood transfusion. So Heather will have that set up very shortly.
So Dr. Boyd was successful in removing all the coins by taking this tube, which has a camera on the end of it, and she can see then at what's going on at the tip. She goes down into the stomach and uses this special instrument to snag those coins and pull them out.
Yes, that's what's happening.
And she got each and every one with that.
Yes.
How long did that procedure take?
This procedure took her about half an hour.
That's a lot less time than surgery, no incision. He's done with that, and then he's going to have his blood transfusion. He'll be going home tomorrow, much less painful than he would have been had he had a surgical intervention.
Right. We'll see him. He'll be back to normal tomorrow, and he'll be going home.
Wonderful.
Mrs. Estrada, if you want to follow me, I will show you where Mulligan's going to spend the night. Just come on back. So we set him up back here in one of our runs. He does have a blanket.
You want to say hi to Mom? Hi, buddy. How are ya? Oh, you got a nice blankie. What a good boy. Okay, and will there be somebody here all night long watching him?
Yes, there will be. There will be doctors and technicians 24/7, so somebody's always going to keep a close eye on Mulligan. And Dr. Camara will give you a call after his procedure to let you know he's in recovery with me and that how things went.
Okay. All right. You be good
All right,
with them.
say goodnight to Mom.
Bye, Mulligan. Be a good boy.
Come on, Mr. Mulligan. I know you're so excited.
Yeah, he turned around very nicely, and he's able to go home the next day.
Mm-hmm.
And so at this point, Heather and Kathy were talking together about the discharge instructions, and so everybody is all set and knows what's going to happen. We also end up faxing a report to your veterinarian so that they're always up to date with what happened here at this hospital.
This was a very comprehensive evaluation on this patient. He obviously needed care. He needed it now. You were here for it. You got it taken care of. The client was informed. They were made aware of every step along the way. I'll have the report on my desk in the morning. I'll have the x-rays to view. I can do the follow-up care. And as a team, this is so important to the care of our pets, and we appreciate all that you do here.
Well, thank you for coming today.
Mulligan. Hi, Mulligan. Open the door. Thank you.
This was a great visit. We saw all kinds of things that our viewers would not normally get to see. You've really opened the place up to us. Thank you for that.
Well, thank you for coming today, and I'm glad you can see what happens at our emergency hospital.
You answered so many of the questions that our viewers have. You know, how does an emergency start? You know, is my pet going to be taken away from me? Can I visit? What's it going to cost? You know, why do all these things happen? And you've really filled a role and helped us out. I understand you also have a wonderful opportunity for our viewers if they'd like to stop by your facility.
Yes, so if they want to come by, we have these pet wheels, and the pet wheels have information on common types of emergencies and what to do if they happen.
So if our viewers want to stop here at the Michigan Veterinary Specialist office on the corner of Walton and Squirrel Boulevard, they can come right in, and you'll have these at the front desk. They'll get to see the place, see what it's like. They've already seen the back. They know what's there, and they'll be familiar with it. They can pick this up and take some of the mystery out of emergencies.
Yes, so please come in for these.
Wonderful. Well, thanks again. Thanks for having us.
Well, thank you.
And we look forward to seeing you again soon on another program.
Yes, you will.
So that's our show for today. What an exciting visit this was at the Michigan Veterinary Specialist. Hope it's taken some of the mystery out of emergencies for you. You know, we work as a team with our emergency and referral centers. These are wonderful folks. They're in a tough spot. They don't know you, but they're here to help you. And with all you saw today, that should help you make the right decision for your pet. So thanks again for watching. It was an exciting 30 minutes all about animals.
Roosevelt signed the Bill of Rights.
I've always appreciated the American Legion's
My gratitude to the American Legion.
Thank you all in the American Legion.
We have millions of veterans that are members of our organization. Thank you.
The American Legion. We serve America and its veterans. We pledge ourselves to our veterans, our youth, a strong national defense, and Americanism. These 4 pillars shape our work and what we do for America. There is power in our numbers. We're the largest organization of wartime veterans in the nation. We are 2.5 million members strong, men and women from every state in the nation and around the world. No other veterans organization wields this kind of power. We work relentlessly within our 4 pillars of service, and we succeed. The American Legion takes care of our fellow veterans and their families. We maintain close ties with Congress and the leaders in Washington, D.C. They respect us. They listen to us. We sponsor research and press for medical care and benefits for all veterans and active duty service members, whether they are members of the American Legion or not.
President Roosevelt signs G.I. Joe's Bill of Rights.
You've heard of the GI Bill of Rights, one of the most important pieces of social legislation of the 20th century. It was written and passed largely through the efforts of the American Legion. We were instrumental in the formation of what is now the Department of Veterans Affairs to make sure our veterans get the care and benefits they are promised and deserve. The young people of our nation are our future. They benefit from exceptional programs and generous scholarships that only the American Legion offers. We provide athletic programs like American Legion Junior Shooting Sports, Legion Baseball, and educational and civics programs like the Oratorical Scholarship Contest and Boys State and Boys Nation.
As Supreme Court Justice Hugo Black stated, the quality of justice that Americans receive should not depend upon the amount of money they have.
We promote citizenship and an appreciation of government. We have all been directly involved in our nation's defense as wartime veterans. We know what policies, tools, and manpower our military needs to protect this great country. We fight to get these things done.
We're all very grateful to have the American Legion on point.
We take our case all the way to the top in Washington, D.C. to ensure that America is prepared for any threat. We are patriots through and through. We believe in our flag and all that it stands for. Our Constitution, our Pledge of Allegiance, our way of life are all fundamental to maintaining our freedom and the standing that we have as the greatest country on earth. We promote and defend these values every day in communities across the nation. These pillars represent not just what we do, but who we are. We're here to serve our fellow veterans, their families, and all of America. We are here for them. We are here for you. The American Legion asks you to join us in our mission. If you share our vision and commitment to America, visit our website at legion.org or your nearest American Legion post today.